Best vitamins for liver health. What does science say about taking vitamins for liver repair? So is it possible to improve your liver health with vitamins? Vitamin E is a fat-soluble compound that helps protect cell membranes from oxidation and destruction. Vitamin E deficiency is often reported in people with chronic liver disorders, particularly cholestatic liver diseases, alcoholic liver disease, and liver cancer. A systematic review published in 2020 summarized findings from 8 randomized controlled trials. These trials evaluated the effects of vitamin E supplementation in people with NAFLD. All 8 trials evaluated changes in liver function tests after vitamin E treatment, with 6 reporting improvements. 6 trials evaluated the effect on steatosis, with 4 noting improvements. 4 trials examined the vitamin's effect on inflammation, with 3 reporting improvements. 3 trials evaluated the effects of vitamin E on hepatocyte ballooning, with 2 noting improvements. Fibrosis cirrhosis was the only marker that did not widely suggest improvements with vitamin E treatment. Of the 5 trials that examined this marker, only 1 reported improvements. The authors of the analysis concluded that vitamin E has significant potential to improve some indicators of NAFLD. This may be the case, particularly when used together with lifestyle adjustments and certain medications. A systematic review and a meta-analysis have confirmed these results. Natural sources of vitamin E include the following: nuts and seeds, canola oil, soya, corn, sunflower, wheat germ. However, evidence demonstrates that high-dose vitamin E intake of 400 IU day in those with chronic diseases may increase all-cause mortality. A study also linked the use of vitamin E supplements in smokers to an increased risk of hemorrhagic stroke. On the other hand, vitamin E has reported potential protective effects against prostate cancer. More studies are required to confirm these results. The best thing to do is talk to your doctor before increasing your intake of vitamin E. They can advise you on whether or not it's safe for you and tell you about any risks. Chronic liver diseases are often associated with vitamin D deficiency. Almost 93% of people with chronic liver disease have some level of vitamin D insufficiency. A 2018 literature review found that several studies had reported a significant correlation between insufficient vitamin D levels and the progression of liver disease in people with hepatitis B and hepatitis C. In a recent systematic review of the available studies on vitamin D supplements in people with NAFLD, it was reported that the vitamin had a significant effect on some of the factors contributing to the development of this condition. The authors found that vitamin D supplements improved fasting blood sugar, body mass index, waist circumference, insulin resistance, serum calcium, and alanine transaminase, ALT. ALT is an enzyme that is released when liver cells are damaged and used to test liver function. Another earlier study suggested that vitamin D may be involved in activating and regulating certain aspects of the immune system that affect liver health. Foods that contain vitamin D include the following: certain mushrooms like morels and chanterelles, egg yolk, tuna, fresh orange juice, red meat, fortified products like some fat spreads and breakfast cereals, liver. Cod liver oil is the most common vitamin D supplement. Vitamin C, also called L-ascorbic acid, is a water-soluble vitamin involved in many processes in the body. It enables the biosynthesis of some neurotransmitters and collagen, plays a role in protein metabolism, and has antioxidant effects. Since oxidative stress plays a role in NAFLD, researchers have examined whether or not vitamin C can protect against the condition. Historically, conflicting results have come from studies on the impact of dietary vitamin C on NAFLD and other liver diseases. In 2021, researchers published a randomized clinical trial that observed improved liver function and deceleration of NAFLD with vitamin C supplementation. Another study published in 2020 found improvements in some liver function parameters after 1 month of vitamin C supplementation in patients with hepatitis C. You can increase your vitamin C intake by consuming the following foods: citrus fruits like oranges and lemons, broccoli, black currants, Brussels sprouts, strawberries, peppers, potatoes. Low levels of several B vitamins have been seen in people with liver conditions. Alcoholic fatty liver disease disrupts the absorption and metabolism of many vitamins, including B1, B3, B6, B9, and B12. Supplementing these vitamins is essential in these cases to prevent serious metabolic and neurological complications. However, it is not proven to improve the liver disease itself. On the other hand, research published in 2022 found that supplementing vitamins B12 and B9, folate, could delay or prevent the worsening of advanced NAFLD cases. Vitamin B6 deficiency has been seen in people with cirrhosis, which experts often link to increased oxidative stress and reduced antioxidant activity. Being deficient in vitamin B6 is thought to affect the liver's antioxidant capabilities. Foods and supplements containing B vitamins include the following: green leafy vegetables, fruits like watermelons and bananas, chicken and beef, macadamia nuts, dairy products like milk and cheese, yeast and nutritional yeast, whole grains and cereals. Vitamin B12 is only found in animal products such as meat, fish, and eggs. Supplementation with vitamin B12 is essential if you primarily consume a plant-based diet.